Welcome to the Dr. Nurse Paul Show, hosted by Aspire RN and Dr. Paul. You are watching the USA Nurse Series. Dr. Nurse Paul is an NCLEX expert, having trained and mentored thousands of international nurses past the NCLEX RN for over a decade. He graduated with a Doctor of Nursing Practice in Texas Christian University. He is a registered nurse, an advanced practice registered nurse, and a certified family nurse practitioner. He also has completed a Certificate for Nurse Educator postgraduate course. Aside from teaching, he has extensive clinical experience in emergency and family medicine. He has over 15 years of combined clinical and academic healthcare experience. Dr. Nurse Paul is an immigrant from the Philippines. He is currently based in Houston, Texas, where he operates his business, Dr. Nurse Paul, and Aspire RN NCLEX Prep. He loves to share his life story of how he overcame his challenges to reach his dreams. He is passionate in helping nurses realize the American dream. So without further ado, let's all welcome Dr. Nurse Paul.
Good morning, wonderful nurses. Thank you for joining the Dr. Nurse Paul Show. There you go. We're having a lot of viewers come in right now. So please, if you guys don't mind, please share this to your pages so we can bring in more nurses to join us today. We're going to talk about a very important thing today. We're going to talk about Next Gen NCLEX. This is one of my shows we call The Secrets of Next Generation NCLEX. And today I'm going to give another example of a case study that we're going to use for the Next Generation NCLEX. Who's excited for the Next Generation NCLEX? All right. And if you guys are watching today, would you guys like to put in the comments your name, your location, what time is it there? I'm back here in my office here in Houston, Texas. So I'm by the south of the United States, southeast. And right now it's 8 a.m. here in Houston, Texas. I just arrived yesterday from the Philippines. And yesterday we had a telecast of my show. It was a replay from my first episode for season 2, which aired last January 7, because I was on flight and I couldn't make it back on time. But I told my team that I still want to do a show. That is why we're doing it on a Sunday. Supposedly, the Dr. Nurse Paul show is done every Saturday, 8 a.m. Central US time. And thank you guys for joining. We have Linzel from Philippines. It's 10 p.m. right now. Thank you for joining. We have Kobe joining us from Ghana, and it's 2 p.m. there right now. Thank you, Linzel in Ghana. And my dear friend is here, Ma'am Joy. I call her Ma'am Joy because she was my advisor during my master's days, during my graduate school days back in the Philippines. It's 5 p.m. there. Thank you for joining, my dear friend. We have Maria from UK, Rose from Saudi Arabia, Umana from Nigeria, and it's 3 p.m. there. Regina is joining us from the Philippines, and it's 10 p.m. Thank you guys. Please share this on your pages. We're still waiting for more viewers or our peers to join us today. We're going to talk about case studies. I'm very excited to do this. We are like less than 60 days to the implementation of the next gen NCLEX. I've been talking about the next gen NCLEX in my social media at the Dr. Nurse Paul and Aspire RN, which is the company I built for the NCLEX review program, since I'd say July or August last year. And it has been my passion to make sure that nurses, particularly you guys that are going to be taking the NCLEX after April 1, are aware of what's changing, of what's going to look like, and what are the tips or test taking strategies that we can use to do to attack this next generation NCLEX. Definitely, it's going to be a challenge because it's new for everybody, including educators like me. But don't worry, I'm the next gen NCLEX expert. I've been doing this for a couple of months now, and we're getting better with our delivery, and we're getting a lot of feedbacks, good feedbacks from people who watch us and people who joined our team in Aspire RN. This show, by the way, is hosted by Aspire RN, my NCLEX company. Thank you to my team that are on right now and moderating this show. Thank you guys. And of course, the Dr. Nurse Paul social media team. Thank you guys for being with us today. And we have a lot of people joining us today. We have Terry from UK. Layson is joining from Armagh City, Philippines. Jack is also joining from the Philippines. Randall from Kuwait. Jonalyn. Jill from the Philippines. We have Mika from Saudi Arabia. Gigi from the Philippines. Cheng from the Philippines. Diane and Jill from the Philippines. And there we go. Who's going to be taking the NCLEX for the next gen NCLEX, which is after April 1. So we're here to help. I do 1 hour classes or live shows every first and third Saturdays of the month for the secrets of next gen NCLEX. So tune in and follow me on my page at Dr. Nurse Paul in Facebook, Instagram, TikTok, and YouTube. And I'm streaming this live today in 4 channels: in Aspire RN channel, in the Dr. Nurse Paul Facebook channel, in Lefora, which is a group I administrate, Lefora Facebook channel, and the Dr. Nurse Paul YouTube channel. But don't worry, I can see all of your comments in the comment section. This is going to be a very interactive show because we're going to answer one case study with 6 questions. Let me repeat that. We're going to answer one case study with 6 questions. This is a fresh case study from the NCSBN pack or NGN pack. And previously, I've already given you a couple of case studies and trends and bow tie questions. So if you have not watched one of my shows, please go to YouTube and look for the Dr. Nurse Paul show. And you can see the playlists there of all the live shows that I did, both the USA Nurse series and the Secrets of Next Generation NCLEX. I think in the Secrets of Next Generation NCLEX, I've already did I'd say 7 or 8 episodes already. This is probably my 9th Correct me if I'm wrong, but everything is there in my YouTube channel. If you can find it, send me a message right now in Dr. Nurse Paul social media pages, and me and one of my team members will get a hold of you to tell you where you can find those playlists. And if you haven't followed me yet, please follow me on TikTok and Instagram. I'm very active in those social media channels, and I only use Facebook mainly for the live show, but very active in social medias, Instagram and TikTok, where I put out shorts and reels. So you can gather information in less than a minute, right? But this is gonna be a full hour of a show. And let me put in my slide. Welcome to the Secrets of Next Generation NCLEX show. We have more people coming in. Wonderbird from Cebu. I think Wonderbird is one of our previous winners. Thank you, Wonderbird, for continuing to support Dr. Nurse Paul and Aspire RN. We also have Tanuja joining us today. If I'm not mistaken, Tanuja is also one of our winners for NCLEX package in one of our shows in the past. Catherine is joining us from Manila, Philippines. I was just there a couple of days back. I just came back yesterday. Gigi, Davao City, Philippines. Tanuja is from Sri Lanka, actually. And Jai is joining us from Qatar. Welcome to new viewers. And thank you guys for tuning in with me today. I know it's very abrupt for me to do a show on a Sunday. It should have been a Saturday. But like I said, I just came back. I just flew in yesterday from the Philippines, my home country. I visited family and friends, and I haven't visited the country for 5 years. And what I actually did, the reason why I flew back home is I surprised my mom and my family with a house that I built and paid for cash, thanks to the American dream. And finally, that's one mission that I completed again. And I've only been here in the States for almost 6 years, and I've already checked a lot of things from my missions. I'm so happy to show my mom the house. I'm so happy to furnish the house. And I actually interior designed my house. I'm so excited to put up the video very soon. So tune into my social media page. My mom is very surprised. I love her. We had a very challenging past experiences, and I'm going to share that in one of the videos. But I'm very happy to be able to build a house for my mom. I mean, which child does not want to build a parent or their parent a house? And I feel very happy. That's where I funneled all my resources financially in the last 2 years. But I'm very happy with the outcome. I'm very happy with my mom, with how she was happy. And I flew in back to the United States with a very happy heart, with a very positive, very positive energy surrounding me right now because I made my mom happy. And that's thanks to the American dream. And I know all of you guys that are watching me today are actually here because you want to pass your NCLEX, and most of you are wanting to practice in the United States. This is your ticket to the United States, and if I can do it, you can do it as well. Yay. And thank you guys for joining. Many people are coming in. Glyza Agbayani from Quezon City. We have someone from Naga City. I could not read the name. Novelin from Philippines. John Lynn says, congratulations. Thank you so much. I was so happy to show my mom the house, and I'm going to show that in my social media very soon. And that's not to brag, but that's to inspire you guys that if I was able to do it, you guys can do it as well. I'm going to show you through my social media all the things that happened to me, whether good or bad, mainly the positive things that happened after I decided to pursue my American dream. And my story is out there. I keep telling about my story out there, but I want to use my life story as a message to everybody that if I could do it, you could do it as well. Luigi is saying congratulations. Thank you, Luigi. And Nurse Sisa is here in Saudi. And someone is from Japan. I could not see the name. I'm sorry. You might be joining from Lefora. And Kath is from Nueva Vizcaya, Philippines. Jobert is from Cavite. Thank you guys for joining us today. All right. And today, I have one more surprise for you before I start. There will be one winner of a Aspire RN NCLEX review package. And this review package is what we call the Dr. Nurse Paul method. You guys are hearing it first right now, live in my show. We're going to be launching our own next gen NCLEX ready review program that it will be called the Dr. Nurse Paul Method. So watch out with the full announcement tomorrow in my Aspire RN Facebook page and website. But I'm already announcing it today. We are going to be doing or rebranding our NCLEX package as the Dr. Nurse Paul Method. This is an NGN ready review package for all our students that are currently enrolled and students that will be enrolling in the future. No other foreign grad NCLEX review provider could do that. No other foreign grad NCLEX provider has ever done that, has ever made their review program NCLEX next gen NCLEX compatible because I don't know, but it's important that you guys join the right team and Inspire RN will just do that. I'm going to talk to you guys about that in a little bit. And to join this giveaway, there will be one winner for tonight of an NCLEX review package hosted by or sponsored by Aspire RN. And you can check aspirern.com right now in your website to see what Aspire RN is all about. And to join this, you got to like the Dr. Nurse Paul and Aspire RN Facebook page. You got to share this live show to your page right now. And make sure that when you share this live show, it's in public setting. So it should be shared publicly. That way, when my team verifies after they draw your names and you win, they will be able to see that you actually shared this on your page. And comment hashtag Dr. Nurse Paul. That will be your entry. You only need to hashtag Dr. Nurse Paul only once because if you do it multiple times, you might get flagged by the system and you can get banned by the system because we're using this webinar app called StreamYard. So I don't want to do that. So make sure that you follow the mechanics like Dr. Nurse Paul and Aspire RN Facebook page. Share this show right now on your Facebook pages and make it public so we can verify that you did if you win. And comment hashtag Dr. Nurse Paul. We are using an app called Comment Picker where it will randomly select someone as a winner. And before we announce that, of course, my team will need to verify first if you guys have followed the instructions. So, who's ready to win an NCLEX review package from Dr. Nurse Paul and Aspire RN? Who's ready to pass the next gen NCLEX? Can you pass the next gen NCLEX? Let me hear you say, yes, I can. Can you put that in the comments? If you're ready to pass the next gen NCLEX and start living your American dream, your Canadian dream, and your Australian dream to pass the NCLEX, say, yes, I can. Let's do it. There you go. We're receiving a lot of comments right now. Thank you guys for again for participating. This will be thank you. This will be a very interactive class because again, we're gonna do a case study. If you have not attended one of my shows in the past, I'm gonna flash a case study and you're gonna help me answer that, and I'm gonna tell you the correct answer and now to attack questions that I show you live, right? Wonderbird is taking his exam on April 20, and I believe you're my student already. So keep communicating with me. You have your own personal student advisor and mentor. So please communicate regularly with our team so we can guide you properly. Don't forget to follow your study plan prescribed by Dr. Nurse Paul and Aspire RN. Thank you guys for joining today. All right. And today we're going to talk about the case studies. All right. Again, to win an NCLEX review package, make sure that you like Aspire RN and Dr. Nurse Paul Facebook pages. Share this show publicly on your individual Facebook page and comment hashtag Dr. Nurse Paul. Thank you guys for joining. And please tag your friends in the comment section so they can see the show because sometimes, it might not come out in your friends' Facebook profiles or YouTube. So please tag your friends right now or send them this link so they can join us in the show today. They can be at work, they can be at home, but they will be taking their next gen NCLEX just like you. So they might need this show to help them and guide them. Let's spread the word and help more nurses get the information out to more nurses. All right, case studies will show nurses' notes that present an evolving patient scenario. There will be different tabs based on my previous shows that I did. There will be different tabs that you guys have to check. It could be the nurses' notes, the labs, the lab results, the diagnostic test results, the progress chart. There could also be medications, history of present illness, history of past medical history and past surgical history, medications record. There will be multiple tabs that you will have to flip through, usually maximum of four, and you would have to read everything in order to answer the case study. If you fail to read all of the tabs in the chart, it looks like a chart, like you're reading a patient's chart or electronic medical record. You're going to miss important information if you don't read them properly. So make sure to read the entire case scenario first before you go answering the question, right? And each case study will have six questions. One case study or one patient scenario, six questions, right? All six questions will be part of the clinical judgment model. So that question number one will be about recognizing cues. Question number two will be about analyzing cues. Question number three will be about prioritizing hypothesis. Question number four will be about generating solutions. Question number five will be about taking actions. And question number six will be about evaluating outcomes. If you are not aware with the clinical judgment model, I've discussed this repeatedly, but you can go back to season one, episode one, What is NGN? That's the title of the show in YouTube, and you can find there my entire explanation of why we need to do case studies, right? And for a minimum item of 85 items, that's going to be the minimum now, there will be three, at least at the very minimum, three case studies, and each case studies will have six questions each. Again, three case studies, six questions each, and you will have 18 questions relating to case studies. 18. It could be more. It could be up to 10 case studies according to the NCSBN conference, but your minimum is three. Who's ready for case studies? I'm so ready. All right, we're going to talk about sample case study right now. We're going to read the case, and then you're going to tell me your answers. Can you pass your NCLEX? Say, yes, I can, or type, yes, I can. Can you pass your next gen NCLEX? Type, yes, I can. Let's manifest that and fill ourselves with positivity and hope that we will be able to take on the challenge of the next gen NCLEX. All right, you guys are ready? All right. I think everybody's ready at this point. All right, let's read the case. This will be quite a very, I like it because the case is very, I'm an emergency nurse, right? I'm an emergency trauma nurse, and it's really related to trauma. So we'll find out, all right, what the case is all about, all right? I already gave you tips. Let me just sip my coffee. It's too early. And I'm still suffering from major jet lag coming from the Philippines, which is 13 hours, 14 hours time difference. And yesterday, I wasn't able to sleep when I got in. I was able to sleep at around 11 a.m. or 10 a.m. to 4 or 5 p.m., which is around midnight to like the morning in the Philippines. And I couldn't sleep the whole night. I probably took a nap at around 5, and I have to wake up at 6 to prepare for this show. And now it's around 8:20. So really not have enough sleep. I just showered a little bit and freshened up so I won't look like I'm a zombie. But jet lag is real, and it's the last time I did this trip to the Philippines, my jet lag lasted for about 2 to 4 weeks. So pretty intense, if you ask me. I'm just taking melatonin tonight. But let me grab my coffee real quick. All right, let's talk about the case study. Let me enlarge that screen. You're going to see me on the right lower side. All right, that's as far as I can bring it up. Again, question number one will be about recognizing cues. So this is your assessment in your nursing care plan. Let's read it together. The nurse in the long-term care facility is caring for a 19-year-old client, 19-year-old. Look at the nurse's note at 11 o'clock. Client has piloerection on the arms and legs. Can anyone tell me what is piloerection on the comment section? Come on. And diaphoresis on the forehead. Client is wearing new low-top athletic shoes purchased by the client's parents instead of the prescribed foot splints. During abdominal palpation, a semi-firm mass is noted in the lower quadrant. Bladder is non-palpable. Very good. Piloerection is also known as goosebumps, right? Very good. So you got the nurse's notes. We're going to flip through the other tabs because you still have history and physical vital signs and lab results. Very, very, very important, nurses, that you're going to have to check all the tabs before you go to the question section. So let's look at history and physical. Let's see what's happening. In the neurological, the patient has spinal cord injury and C4 spinal cord injury from a gunshot 2 years ago and uses a sip and puff wheelchair. Sip and puff wheelchair is a type of wheelchair where they use air to sip or puff to control the wheelchair to move. All right, so you can YouTube that. Very good for patients with quadriplegia that cannot move their arms. They use sip and puff to move their wheelchair. So which tells us that this patient is actually quadriplegic. I mean, if you have a C4 injury, you're quadriplegic, correct? Pulmonary patient is on pressure-controlled portable mech vent and on tracheostomy. Endocrine, the patient has type 1 diabetes. Psychosocial, the family lives 3 hours away from the facility, sends the client designer clothing and gifts once a month. Wow, rich family. Friends have not visited client in 1.5 years. Client prefers to sit in room alone rather than interact with other residents, right? So I guess what's important here is the patient has a spinal cord injury at C4. Vital signs, temperature 99. A little on the high end, but it's not fever until it's 100.4. Pulse 56, it's a little bit low. Respirations 18, normal. Blood pressure 192 over 102, high. Pulse oximetry is 97 on mechanical ventilation, that is normal. Lab results, serum glucose 140 and our normal is up to 140. So I guess this is normal. All right, you guys ready to answer the question? Let's now go to the questions area on the right side of your screen. Which of the following would require immediate follow-up or priority assessments? Select all that apply. Hold up, listen, nurses. This is going to be a right minus wrong or correct minus incorrect type of question. Remember, in the past episodes, I talked to you about 3 different scoring systems, right? And this will be one of those where we get partial scores. So it will be correct minus incorrect. Be very careful with answering questions like this, because if you have more incorrect questions or answers versus correct answers, then you're going to get 0. Be very careful, right? So what are the immediate follow-up assessments? Pulse, respirations, diaphoresis, piloerection, blood pressure, serum blood glucose result, or wearing low-top athletic shoes. What are your answers? Can anyone answer this with me, please? Anyone? Again, while we are waiting for the answers, if you want to join the giveaway and want to win one NCLEX review package unlimited for 1 year from Aspire RN, all you got to do are 3 things. 1, like Dr. Nurse Paul in Facebook page and Aspire RN Facebook pages. 2, share this show publicly to your timelines or your page. And 3, comment hashtag Dr. Nurse Paul. That will be your raffle or giveaway entry so the comment picker can see your name. All right? And tag your friends so they can join the show. More people are joining. Thank you guys for joining the Dr. Nurse Paul show. For those who are late, we are doing a case study for the next generation NCLEX, which is what we do every Saturday, 8 a.m. Central Standard Time, the Dr. Nurse Paul show. All right. We're seeing a lot of answers from people in the comments. All right. Some have 4 answers, some have 3, some have 2 answers, some have 1. Guys, remember, this is a correct minus incorrect answers. So if you have a lot of incorrect answers, then you can get 0 from this question alone. Be very careful with SATA. Now in next gen NCLEX, it will be correct minus incorrect for select all that apply. All right, you guys ready? All right, I guess I'm ready to say my answers. Please tag your friends so they can join the show. This is our first question out of 6 questions for this case study. All right. All right, let's see. The answers are, what are your areas of concern? Immediate follow-up. It will be pulse. You can see the check mark. Diaphoresis, piloerection or goosebumps, blood pressure, and wearing low-top athletic shoes. Because in the first place, the patient should be wearing foot splints as prescribed, but the family changed the patient into a sneakers or a tennis shoes, or a runner. So We're going to include that in our immediate follow up. So 1, 3, 4, 5, 7. If you have only answered 4 or 3, then you get a deduction. Anyone got this question correctly? I see. Not many people included 7. But guys, that's a very significant finding. You will understand why. If you have already figured out what's going on with this case and you had a differential diagnosis in your head, you will actually include wearing low top athletic shoes because that's a significant finding. Remember, the prescription was to use a foot splint, and there's a reason for that. The patient is experiencing quadriplegia, which means, shoes that are not prescribed can cause abrasions, excoriations, frictions, pain, pressure, ulceration, so many other complications that the patient might not even be aware of until they can see a wound or their bones in their ankle. So very important for quadriplegic patients that we take care of their skin, particularly in high pressure areas such as the ankles. And I see that many of you did not answer number 7. A lot of people did not answer number 1. Why? Because it's 56, sir. It's like 4 points below the normal. It's still below normal. It is a significant finding because the patient has a quadriplegia and a neurologic complication or disorder, which is a spinal cord injury. We're going to connect the dots later when we go to the diagnosis. Who got this correctly? I'm afraid I haven't seen anyone got everything correctly. There was one that was close. That was Wonder Bridge was close. He's gonna be taking his NCLEX soon. Wonderbird. Answered 3, 4, 5, 7, missing number 1, which is good. But remember Wonderbird, and for everybody, every significant finding gets included. Right? You can answer everything up to 7 if you really want to, but that's not the answer. Okay. Anyway, and Mabel also answered 3, 4, 5, 7. They're pretty close, but not close enough. So with that, they get 4 points. The rest get 3 and 2 points. And if you have answered number 2 and number 6, then you get deductions for that. Is this clear? Any questions before we move to the second question? Yes? All right, let's see the second question. I think we have a new finding. Right? Remember, case is evolving, right? So it's like watching a patient for the whole 12-hour shift. So let's see 1115 notes by the nurse. It said an intermittent urethral catheterization was performed and 400 ml of clear yellow urine was obtained. And the client has facial flushing and foul smelling liquid stool leaking from the anus. A semi firm mass is still present in the left lower quadrant of the abdomen, right? So that's your new finding. Catheter was inserted. We were able to drain 400 ml, which I mean, that's pretty good amount of urine. And let's go to the question. The nurse should recognize that the client is potentially experiencing what? This is a new drag and drop format. It's a drag and drop close format. And this type of question is also right minus wrong, right? Right minus wrong or correct minus incorrect. So what are your 2 answers? The nurse should recognize that the client is potentially experiencing what conditions? What conditions? Anyone? 2 answers. Again, for those who just joined, you can still win an NCLEX review package by following 3 things. 1, like and follow the Facebook of Dr. Nurse Paul Inspire RN. 2, share this show, this live show in your pages publicly so we can see it. And number 3 is to comment hashtag Dr. Nurse Paul so you can have 1 entry. You only need to do it once. And thank you to those who join. And later in this show, we will have 1 lucky winner of the NCLEX review package, 1 year unlimited from Aspire RN and Dr. Nurse Paul. Anyone? We got diverse answers right here. Do we have urinary retention? Anyone? Do we have signs of urinary retention? What do you guys think? What do you guys think? But let me go back to the 11 o'clock notes because it says their bladder is non-palpable. We know when you palpate bladder, you know it's bladder, right? It's bouncy, it's fluid filled, it has tympany, right? When you palpate it and percuss it. And in 11:15, we were able to drain 400 mLs of clear yellow urine. It's more than enough. If it's 30 ml per hour, then that's like 10 to 12 hours worth of urine. So that's plenty amount of urine. There's no obstruction. There's no urinary retention, right? Um, Urine was already obtained. And the question is, what is being experienced potentially? If you've already managed the urine, then there's no urine retention already because the urine was already cleared. Let me repeat that, all right? The urine was already drained out. So it's no longer a potential problem because it's already been intervened with and it's already been tackled or managed already. So there's no reason to include that in the answer. I'm sorry, but a lot of people answered urinary retention. Some people answered infection. That's not an answer as well because there's no sign of infection, there's no fever, right? What is potentially being experienced by the patient? It's fecal impaction. That's very clear because you see the leaking fluid. That's a sign of fecal impaction. There's lower left quadrant. Um, what's this soft mass that is palpable? Usually, it's fecal impaction. It could be something else like diverticulitis or a sigmoid colon cancer. But in this case, it might be fecal impaction. It's those things that I mentioned. It's not even in word choices, right? And this is possibly autonomic dysreflexia. If you take into consideration everything that's been going on with the patient so far, decreasing pulse, increasing blood pressure, piloerection, diaphoresis, fecal impaction, which is one of the most common factors for autonomic dysreflexia, then I will answer autonomic dysreflexia. All right. And I see quite a few people got this correctly. Thank you. All right. And for those who didn't get it correctly, don't be mad at me. You can take my answers as an opinion, or you can take my answer as an NCLEX expert answer, and it's really up to you what you want to do during your NCLEX. But honestly, infection is not the answer. There's no sign of infection. Urinary retention is not the answer because that's not a potential problem at this time. It already has been managed. The answer is fecal impaction and dysreflexia. Yay! Clap your hands. We got this option correctly. If you got this incorrectly, then it's right minus wrong. 1 minus 1 is 0. I'm sorry, but you don't get a point in this round. But that's okay. That's why we're doing this live show so we can teach you the techniques of how to do this correctly. All right. But very important. You see the very important thing here is knowing the signs of autonomic dysreflexia and being able to connect signs and symptoms to pathophysiology and to their managements, right? So, with NCLEX, with the next gen NCLEX, only the testing format, item types, and scoring system have changed. The contents, nursing contents have not changed. Autonomic dysreflexia remains the same, regardless if it is the old generation NCLEX or new gen NCLEX. So, next gen NCLEX should only be half of your problem. The most important thing, especially if you're out of practice for a long time, if you've failed your NCLEX in the past, if you're a new grad and you don't have clinical experiences because clinical judgment is now part of next gen NCLEX, or you're struggling with answering so many question banks and you still can't understand why your scores are below 60 and not consistently getting above 60. Guys, the main or the most important thing, and I've kept mentioning this in my social media, is content, mastery of content. If you don't understand what autonomic dysreflexia is, the case study will not help you either. The case study is only helping you connect what you already know with a clinical scenario. But if the problem is what you actually don't know, or you don't know anything about this certain case, it will be hard to answer case study and you will actually have a problem because this is 6 questions tackling the same thing or talking about the same thing, such as autonomic dysreflexia. It will jeopardize your success in the NCLEX. But I'm just telling you the reality. I've been teaching NCLEX for 15 years and this is what the problem that I see. particularly with us foreign graduate nurses, because we're not educated here in the US, right? For a bachelor's degree. But this is why I built the Dr. Nurse Paul show, or created Dr. Nurse Paul show. And I'm doing, I opened Aspire RN to bridge these curriculum gaps, right? Very important, because I'm bringing in my experience both in the US side as an educator and in the Philippines as a foreign grad. Combined together, I made a formula we call the Dr. Nurse Paul method that will essentially help you, guide you, and assure or guarantee you're passing the next generation NCLEX. So if you're still on the fence, contact my team now, and we're going to walk you through, help you decide which program is best for you, okay? Don't be scared. We can do this together, okay? Anyway, let's go to question number 3, prioritizing hypothesis. Look at 1130. Client now reports a headache rated 10 over 10 on the numerical scale and blurred vision. So on top of what we already know, patients are developing blurred vision, headache, clearly a sign of possible increased intracranial pressure, which is a problem with spinal cord injuries, right? Now let's answer again. The nurse should recognize that the client is most likely experiencing what? We can only choose one from the 3 words that are presented. Is this infection? Is this autonomic dysreflexia? Is this abdominal aneurysm? Anyone? Anyone? We've just talked about this. You're just going to choose one answer from earlier. What's your answer? Is this abdominal aneurysm? The patient has headache. The patient has spinal cord injury. Spinal cord injuries are at risk. Patients with spinal cord injuries above T6, which is from C1 to T6. See, this is why it's important that you guys do your content review. And I discuss this in my classes in the NCLEX. C1 to T6. Whenever you get this spinal cord injury right here, patient is at risk for autonomic dysreflexia. What is autonomic dysreflexia? It's a hyperstimulation of the sympathetic nervous system because of the injury to the spinal cord, the parasympathetic nervous system, which is here in the base of the brain, and the sympathetic nervous system in the thoracolumbar region are not communicating anymore. So now they're working at the same time instead of balancing out each other. When the sympathetic nervous system is triggered, the blood pressure goes up, piloerection, diaphoresis, all goes up, right? And when the parasympathetic nervous system is triggered, the pulse go down. This is one of those conditions where you see the blood pressure go up, but the pulse pressure or pulse rate is going down. Answer here is autonomic dysreflexia. And there are two major triggers, right? There are many triggers. The 2 major triggers are urinary retention and fecal impaction, right? Urinary retention and fecal impaction. Other triggers are stress, emotions, traumas, or pain, right? Do you remember the patient in the earlier case was wearing a low top shoes or a runner or a sneakers instead of the foot splint? The low top shoes may actually trigger discomfort and pain, which can trigger autonomic dysreflexia. That's why we included in our answer in the select all that apply to prioritize wearing low top shoes instead of foot splints. You remember now? Do you guys understand autonomic dysreflexia? And the main concerns are urinary retention and fecal impaction, all right? But urinary retention is no longer a problem because we've already drained the bladder, and the bladder has been drained already. So we're going to focus on fecal impaction as the trigger, and the pain and discomfort from the ankle because of the wearing of the low tops shoes or runners as another trigger. Okay, you got it? So guys, again, don't be scared with next gen NCLEX. What your focus should be, especially if I'm doing this class and you can't follow me because you don't know autonomic dysreflexia, is content building. Very, very, very important that you develop your contents first before you go to next gen NCLEX. Next gen NCLEX is just another way of checking your knowledge and your competency as a safe and effective nurse providing quality care. It's just another way of doing the exam. It's just another way of educators telling you, you know what? We already know you can answer this type of question. We're going to use this type of question instead. It's just another change, but the contents never change. Autonomic dysreflexia is still autonomic dysreflexia. Stroke is still stroke. MI is still MI. Anxiety is anxiety. Schizophrenia is schizophrenia. Pharmacology is pharmacology, no matter what version of NCLEX you are taking. You understand me? Yes, that's why in Aspire RN, the Dr. Nurse Paul method builds on your content first before you move to NGN master classes. No other program has actually sat down and used evidence-based methods based on literature review for foreign graduate nurses to make sure that you guys are getting the best of what you pay. This is what I offer in Aspire RN. So make sure that you make the right choice in Aspire RN. You don't only get proper progression with education, being an educator for 15 years and now practicing here in the United States. But also, you get your personalized feedbacks from your student advisors and personal mentors. No other review centers or program will ever do that for you because we care. And you have last 5 minutes to join the giveaway. One winner for NCLEX review package from Aspire RN today. You might be the lucky one this time, and the mechanics are at the bottom of your screen. Okay, now let's go to question number 4. Let's see. So, same situation, nothing has changed from the last case. All things are still the same as far as your case. Let's now go directly to the question. All right. For each potential nursing intervention, click to specify whether the intervention is indicated or not. You're just going to tell me indicated or not. It's 1 point per box. All right. So per row, I'm sorry, you get 1 point. All right. This is not a right minus wrong. This is 0/1, which means whatever correct answers you have, that's the only point you get. So there's a total of 4 points to get in this question, right? We'll see how much you scored. There's no right minus wrong here. It's straightforward. Whatever correct answers you got, that's your point. All right? Very straightforward. So now, do we need to place the client in left lateral position? Not indicated or indicated? Not indicated. If this is increased ICP, if this is increasing blood pressure because of autonomic dysreflexia, the correct position is high Fowler's position, upright, sitting. Otherwise, pressure goes up to the brain, increase intracranial pressure, not indicated. If you put the patient in left lateral position, you're not managing the blood pressure going up to the brain, and this can lead to stroke and complications like ICP. Remove the client's low-top athletic shoes. Indicated or not indicated? Indicated. Can you put numbers on your answers first before you say indicated or not indicated? Because I don't know which question you guys are answering. Some people have a very high latency in their NCLEX, in their internet, which means I've already moved on 10 minutes, but they're still answering the question from 10 minutes ago. I'm so sorry. So anyway, low top shoes or runners, sneakers, whatever you want to call it, needs to be removed. It's indicated, it's triggering pain and discomfort, it's triggering autonomic dysreflexia. Inform the client that CRADE method will be performed. Here we go. Our friendly Google can help us figure out what is CRADE method. CRADE method is, you've tried to make your patient pee, or catheter the patient, make the patient pee, and the pee is not coming out. What do? We press the bladder, right? Down the middle. We press it so more urine can come out. That's called CRADE method, and we're going to do this to make sure all the urine comes out because, again, one of the triggers is urinary retention. So that's indicated. How about over-the-counter laxatives? It's also indicated because the patient is experiencing fecal impaction. So the only not indicated here is the first option. The rest are indicated, right? Very good. A lot of people got this correctly. Yay, you get 4 points. And we have 3 minutes left to join the show. Come on. Join the show. Share this page. Like Dr. Nurse Paul Aspire RN and comment hashtag Dr. Nurse Paul so you can win the NCLEX review package. This is your chance to win. Every 2 weeks, I give out free NCLEX review package. If you haven't joined my show in the past, I've already given out a lot of NCLEX scholarships and NCLEX review package to lucky winners. All right. Question number 4 is pretty straightforward. For me, it's a very easy question. But again, easy for me because I know the pathophysiology, the signs and symptoms, the risk factors, the triggers, the managements, both pharmacologic and non-pharmacologic managements for autonomic dysreflexia. If you're having an issue with answering this type of question, your problem is not next gen NCLEX. Your problem is content, and you need to build on your contents first, which Dr. Nurse Paul and Aspire RN will help you with. So join Aspire RN now. Watch out during our major launch tomorrow. I'm preempting it already, but we're going to launch the new program we call the Dr. Nurse Paul method, which will incorporate next gen and clicks concepts in every phase of my review program. I'm so excited to launch this. And I've already started rolling it out with our partner agencies. We have 4 partner agencies sending us hundreds of nurses every year. But we still have more room for direct enrollees like you guys. I know it's a little pricey to enroll in NCLEX review program right now, but consider it as an investment that when you get here to the States, you're going to earn $40, $50 an hour. The $600 review fee suddenly doesn't matter because it's for your future. So invest in your future, right? And talk to one of our team members right now to help you get started and figure out what review program is good for you. Let's go to question number 5. And question number 5 does not have anything added to the case, but let's go straight to the what's this? To the plan of care. All right. The nurse is implementing the plan of care. Again, there's nothing added to the case. All right. I've already checked all the tabs. There's nothing added. But okay, listen. When you guys do this in your actual NCLEX, we're going to run out of time. I have 12 more minutes. I'm so sorry. But please check all the tabs to make sure there's nothing new. Okay, remember, case studies are evolving. There might be something new in those other tabs, and it's not going to tell you. You have to open it up. All right. But again, I already did that for you. And there's nothing new in history, vital signs, lab results, and even the nurse's notes. It's the same as question number 4. All right, question number 5. 2 actions that you must take. So this is one of those select all that apply, but actually it's not select all that apply. It's called multiple response select N, or a certain number. We only have 2 options, all right, that we need to choose. What are those? What are those? What are those? We're about to wrap up. 10 more minutes. Thank you guys for joining the show. I'm enjoying this show. Every time I go live and do the Dr. Nurse Paul show, it's very enjoyable for me because I like interactions. Although virtually, it's still fun to see your answers. All right. A lot of people answered number 1, request for hydralazine. What is hydralazine? Anyone? If you guys have attended my pharmacology lecture in the past, or if you were my student, who are currently students of Aspire RN right now, can you please raise your hands up if you're already enrolled in my program? I know you haven't seen me for the whole month of January in your classes, but trust me, you're going to see me again. I was out for 1 month focusing on family. Very good. Hydralazine is a direct acting vasodilator. It's an antihypertensive. Very good. So we're going to do that. We're going to use that because we need to lower the blood pressure. Otherwise, it's going to lead to stroke or increase ICP. What is the other option? Number 2 is incorrect. Anyone answered that is incorrect. I said it should be high Fowler's position. And what else? You need to go to intervention, guys. Remember, number 5, question number 5 talks about taking actions. If you answered number 3, that's not taking actions. That's like generating solutions or evaluating outcomes. That's assessing or reevaluating. We need to intervene. Answer is 1 and 4. Apply lubricant to gloved fingers to remove fecal impaction. All right. A lot of nurses did not answer this because I know the question. I can read your mind. I can read your minds. I've been teaching for 15 years. Sir, can I do fecal impaction removal? Can I digitally remove fecal impaction? The answer is yes. This is part of the nursing scope. But listen, again, scope of nursing practice is vague, right? Has to be determined by the board. But you also need to follow your hospital policies. Most hospitals, all right, would require you to have a doctor's order because it can still cause a risk like anal perforation or rectal perforation. Or what if it's a colon cancer, right? Or rectal cancer. You don't want to make that bleed. So you have to have a doctor's order. But if the question is, can the nurse do it or does the doctor have to do it? Now, certain hospitals would not allow nurses to do it. They're just trying to avoid lawsuit. But yes, Nurses can do that, but it's not independent. You have to have doctor's order. But since we're talking about autonomic dysreflexia, that's certainly one of the answers because, again, I told you earlier that the most common triggers are urinary retention, which we already managed back in question number 2, and fecal impaction, which we haven't managed yet. Earlier, you said we're going to give laxative. Yes, but even if you give laxative, if there's fecal impaction, you still need to digitally remove that. Who has done that in the past? I did. I'm an ER nurse. We do that all the time. Oh my God, one of the patients that I had, this is not HIPAA violation because I'm not saying which patient or who, but that's just one of the stories. All right. I took out like a ball, like a baseball, huge fecal impaction with the help of the doctor, of course, because of course that will be hard to do. So we had to soak that with an enema first. Woo, the things we do for our patients. That's why I admire you guys, nurses. All right. We are determined to do anything for the comfort of our patients. Correct? 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 All right. Okay, so that's 1 and 4. Last question. We have more things coming up. All right, let me take out my camera so you guys can see it better. Elevated head of the bed. Or at 11:45, you elevated the head of the client's bed and removed the client's low top athletic shoes. Requested prescription for digital fecal impaction removal and lidocaine lubricant. At 12 o'clock, the patient is having tonic-clonic seizure, so the client has been placed in side lying position. All right. So those are the two things that came up. Everything that you said earlier that you were gonna do, we already did it, and now the patient's having seizure. But let's look at the vital signs because there's significant changes there. Like I said, you have to check all the tabs. I already checked all the tabs for you. We're gonna extend for a bit to announce the winner. By the way, please don't leave me. All right. But the vital signs have significant changes. You see the temp went down, pulse went down further, RR is already going down, blood pressure is still elevated, pulse oximetry is starting to go down. Now go to your questions on the right side of the screen, right there. And you're going to tell me if it's worsened or unchanged, all right? Worsened or unchanged, all right? Oh my God, I already showed you the answers. Everything worsened, right? Everything worsened. I already showed you the answers, guys. I'm sorry. I'm just too excited to show you the answers. Everything worsened. And you get a total of 4 points here. You don't get a penalty for incorrect answers for this type of question. If you're still confused with how NextGen NCLEX is scored, then you need to watch my previous show that's in season 1, episode 2, types of items. All right. Everything is worsened. Pulse went down, respirations went down, blood pressure went up. Tonic-clonic seizure is not expected. It is a sign that the patient is worsening. All right. How did you guys do? How did you guys do? Anyone? How did you guys do with this question? Any questions about case studies? That was fun, huh? I know a lot of people struggle. Those people who struggle, they're actually the people that have probably have never encountered autonomic dysreflexia or probably have heard it once in their lives and never followed through. Very important that before you take the NCLEX, this is part of my recommendation to my patients, I'm sorry, to my students, to my nursing students, to my nurses in Aspire RN, that you need to develop your concepts first. I keep emphasizing to my students, right? I just realized right now that I'm still peeling. I went to my dermatologist in the Philippines and I did this peel. And when I was in the plane, I was really shedding so bad that the crew, I was in the business class and I woke up one time to like go to the bathroom and he was really concerned. Sir, are you okay? Do you have any medical condition? I was like, no, I went to my dermatology and I did the peel and I was shedding so bad. But whew, there you go. So the peel is all the way down now. But anyway, going back, guys, very important to develop your concepts. I know not everyone perfected this answers to these questions, but that's part of reviewing for next gen NCLEX, right? You know what areas you need to work on. And that's the problem with case study, because if the case study talks about a certain scenario that you've never heard before, what if it's about Duchenne's muscular dystrophy? Now you get 6 questions about DMD, right? What if it's about Paget's disease? Now you get 6 questions about Paget's disease. What if it's about syndrome of inappropriate antidiuretic hormone. Now you get 6 questions about SIADH. What if it's about Wilms tumor, right? Then you get 6 questions about Wilms tumor. So what I'm telling you is the only caveat or the only challenge you would have with a case study is what if the case study that was presented to you is a condition that you don't actually know or know about. So that will be a concern. That will be an issue to you. So make sure that you have very good concept building, mastery of concepts. This is what we do the Dr. Nurse Paul method. We have 3 phases: DNP, or the Dr. Nurse Paul method, didactics, neurals, and precision phase. You'll see this in our social media tomorrow because the official launch is tomorrow, but I'm so excited to say it today. The didactics phase will build on your concepts, make sure that you have knowledge of almost all concepts that come out in the NCLEX. The neural phase will be NGN master classes, where we do NGN master classes. You do test banks as well on your free days. And the precision phase is all about hit classes and final coaching. All right. There will be 42 live classes with Aspire RN now. Nobody can beat that. And I'm adding so much hours of live classes with my students without adding. I think we're gonna have $100 increase tomorrow, but stand by, tune in because I might drop in a promo. This is gonna be released 8 a.m. Central Time tomorrow. Announcement will be released tomorrow 8 a.m. Central Time in the US. But we will be releasing or announcing the new program. But Wonderbird, you're already our student. Don't worry about it. You're going to be transitioned to the new program automatically. No need to add fees or something. But there will be a $100 increase for 8 more classes. You're going to get 42 live classes on top of your student advisor support, personalized mentoring, on top of everything that we're doing for you to help you pass. The goal in Aspire R in a Dr. Nurse Paul is not to make money out of you. The goal is to produce more nurses to help with the nursing shortage. That has been my advocacy. I want you guys to achieve the things that I achieved as well. It's my pay it forward for everyone who wants to live the American dream, right? And follow me on social media. We're going to do more Dr. Nurse Paul shows every Saturday, 8 a.m. Central Time. For those who are late, Ice said she is late or he is late. Don't worry, this show is recorded. You can watch it later, right? And Tanuja was asking earlier, was the respiration was the same? It's actually not. If you look at it, it says the respiration was initially 18 and now 17, right? So it is worsening, right? It's a symptom that we need to watch out for. So we flag it as worsening, all right? And anyway, you can review this question later. For Jobert, he's asking what time the class usually starts. It's this time, 7 p.m. to 11 p.m. Philippine time. And that's about 6 a.m. or 7 a.m. Central US time. But I'm planning to create another class because right now we have 3 classes ongoing every day. But I'm planning to put up another class for another time zone. All right. But talk to my team. They have more information about specifics like this. Drop a message on Dr. Nurse Paul or Aspire RN right now, and my team will be able to answer all your questions. Or I might also be able to answer you directly if I have time later, all right? But anyway, if you guys have questions, send it to my team or send me a message, info@drnursepaul.com, all right? Anyway, if you guys are ready, we are ready to announce our winner for the NCLEX Dr. Nurse Paul method from Aspire RN. Congratulations to our winner. Kobe Arbo. Where's Kobe? Kobe, congratulations. You won. This shows NCLEX review package from Aspire RN. I've seen Kobe earlier. Thank you, Kobe, for joining the show. Thank you, everyone, for joining the show. Don't fear, we have more giveaways that we're going to give in Dr. Nurse Paul shows in the future shows. So please tune in. Make sure you are subscribed in my show, in my Facebook page, YouTube, TikTok, and Instagram. Please follow me and share the good words to your friends. I'm doing a lot of short videos. This is 1 hour. This is too long sometimes. But in TikTok and Instagram, I share small videos, short videos that can summarize many of the things I talk about here in 1 minute, right? But Kobe, send me a message right now. in Facebook at Dr. Nurse Paul, and I'm going to send you the instructions of how to claim your prize. Thank you, Kobe, for joining. Thank you, everybody, for joining. And follow Dr. Nurse Paul, the next gen NCLEX expert, the foreign grad NCLEX expert. And my team will get a hold of you if you have questions. Don't be hesitating. Don't hesitate with asking questions to us. We're going to help you. I'm 2 minutes over. We're going to wrap this up. Please follow the Dr. Nurse Paul to see the Dr. Nurse Paul show every Saturdays, 8 a.m. Central Time. Today is a special telecast because I was on a flight back to the States yesterday and I couldn't make it on time. But every first and third week of Saturdays, we do Secrets of Next Gen NCLEX. And every second and fourth week, we have USA Nurse Series. We have a lot of guests, nurses, and experts that we bring in to join us in the USA Nurse Series to talk about immigration stuff, moving to the United States, and every questions that you may have about it. But I do 2 shows every Saturdays. If you guys haven't seen it, the YouTube playlist is there. Please look at YouTube, Dr. Nurse Paul Show. You go to live playlists, and we've divided it into Secrets of Next Gen USA Nurse Series. I have a lot of episodes in the past. Please listen, download, and share to your friends, whatever you want to do. But put out the word out there. I'm doing this for free, but I want to help you guys whether you enroll in my program or not. So please continue supporting Dr. Nurse Paul. And we're going to bring in more guests in the future. Thank you guys for joining. Karine said she was my former student. Thank you for joining. And anyway, thank you guys. I'm going to leave you guys be. You have a great day. Thank you for joining the Dr. Nurse Paul Show, Secrets of Next Generation NCLEX. See ya.
You have just watched the Dr. Nurse Paul Show. Watch us live every Saturday, 8 a.m. Central U.S. Time. For more info about our future events, follow us on our social media channels. You can find us at Dr. Nurse Paul on Facebook, Instagram, TikTok, and YouTube. See you next week.